the skull to show some of this, the vomer in those two canals. This one's got a couple of things on it. Up here in green is part of the ethmoid bone. I know you have been hearing about this. This little pointy, sharp little piece of bone is called the crista galli. There's a sort of a plate of bone that the crista galli emerges from. It's called the cribriform plate. And then they're really not labeled on here. There's probably another label, but there's tiny little holes in here. They're called the cribriform foramina. They used to be called something much kind of more functional and easier to remember. They used to be called the olfactory foramina because the olfactory nerve for smell kind of used to go through there. Well, they still do go through there, but for some reason they changed the name. So now we're using cribriform foramina. And then this is sort of a purple color here, this bat-looking bone you recognize now as the sphenoid bone, this internal bone. And it's got several little holes in it, the foramen rotundum, the foramen ovale, the foramen spinosum, and arteries, veins, nerves, and things run through there. And a very noticeable notch right here in the center called the sella turcica, and that's where the pituitary gland is located and protected in your body. Probably. Okay, this is a good picture. So, a couple of things here. Sinus. Sinus means an air space. And you need a sagittal section skull to see these air spaces, right? So if you look, and this is a sagittal section, right here in the frontal bone, air spaces, frontal sinuses. If you saw the sphenoid bone in half, it's also hollow, sphenoid sinuses. The ethmoid bone is also very hollow, ethmoid sinuses. You can see in this one, though, crista galli. And then very few of our skulls have this on because it's so fragile, but you can see it on the skeletons. A very noticeable plate of bone which extends down from the ethmoid bone, and that's called the perpendicular plate. And here's the vomer. And you can see they always kind of come together right here. Well, they do kind of come together right here. Right? So here's the vomer. If you're looking at it inferiorly, you'd be down there, and they kind of come together like this. Most of our skulls just don't have that intact, but look at a skeleton. You can see how it looks. Probably about all we need on that one. But anyway, I'd like to use, so remember, look at the sagittal sections for the sinuses. Occipital bone is really nothing particularly interesting. I mean, there's stuff on here, but nothing you don't know. Okay, here's mastoid. Here's temporal bone. So now a couple of questions last night about the difference between squamous portion and petrous portion of the temporal bone. Okay, so this is looking at the temporal bone like here. And this flat portion is called the squamous portion because squamous just flat out means flat, right? And if you look in the inside, I know you've seen it now, there's kind of this raised area of bone in here. That's the petrous portion. And there's a little hole in it. And that's the internal acoustic meatus. The structures we talked about just last week, the vestibular complex, the semicircular canals, the cochlea, are located inside this bony structure. So that you get a feeling how small it really is. Also, from the external view, this is the external acoustic meatus, basically, your ear canal with the flesh taken off. And we have a couple of these. If you cut through the mastoid process, which is the bump right here behind your ear, it's actually fairly hollow, and they're called mastoid ear cells, and so or mastoid sinuses sometimes. You can see it is very hollow. So the skull really is light because of all these air spaces. If it was just solid. It would weigh a lot. So anyway, so this is the temporal bone. It's got quite a few features on it, but most of them I think you know now. The orbital complex, these are the bones that form the orbit of the eye. The orbit of the eye is a very complex structure. Very complex structure. Frontal, maxilla, lacrimal, ethmoid, sphenoid, palatine, and zygomatic. Those are the bones which form the orbital complex. The next picture is from your book, which actually shows you where those bones are. Some form more of it than others, but these are the 7 bones which together form the socket of the eye. And here's the picture. So let's see what we got here. Well, certainly the zygomatic bone, a bunch of it is the zygomatic bone, and here's the maxilla, and a lot of the maxilla fills in there. You can see the sphenoid back here, you can see the frontal, and boy, just a tiny little part of palatine bone. That'd be hard for anybody to find probably. Just a really small portion of the ethmoid bone, and the lacrimal bone itself forms part of the orbital complex. And here's the little groove in it as well. And this is, as I said, this is a bone which is often has gone missing in many of our skulls. So that's the actual color-coded breakdown of the bones of the orbital complex. You can understand now when you think about reconstructive surgery for people who have had, traumatic accidents to the face and things like that. It's a big job when you're trying to put these bones back together. It's a lot of skill. All right, here's the back. This is the sphenoid bone, the greater wings, the lesser wings, cella turcica, optic canal, the foramen's down here, the rotundum, the ovale, which is oval, and the spinosum, which is tiny and little. There's things on here which you don't need to know, like the dorsum selica and other things that are on here. One that doesn't show from this view are the little legs that come down, and those are the pterygoid processes. And I know those are pretty easy to find. But so even before you ask, like, well, which bone are you? If the sphenoid bone is on the test, gee, are you going to use an intact skull or one of these kind of plastic kind of sphenoid bones? And the answer is either, actually, or probably both. It just depends on what you're trying to show. Oftentimes, one of these just by itself is a little easier to show the structures on, especially the wings. A little harder to see when it's inside the skull. But anyway, I don't know, I guess it kind of looks like a bird of some sort. So, these old guys way back in the day when they were dissecting human bodies in secret because it was against, the law to do it, they were, learning this kind of stuff. I don't know much about this.